Hi, this is Harry Campbell from Biofeedback Resources International, and I just wanted to do this short presentation on why psychologists should incorporate biofeedback into their work. So, number one, it can enhance the therapeutic outcomes through using mind-body science. There's a lot of talk about mind-body, and it's something that people may not truly understand because they are not necessarily able to see what's happening with the mind-body connection. And biofeedback is a way to actually show people something measurable that they can understand what's going on with the mind-body connection, and it makes it more real to them. So it kind of speeds up the learning. There's evidence-based for biofeedback. It's an intervention that has been around for quite a while. There's research over a period of decades in psychology, so in mental health and also in physical medicine. It's effective for things like anxiety, depression, ADHD, PTSD, and also chronic pain. That would include tension headaches and migraine headaches. And it has been recognized by the APA and other professional organizations as an effective intervention. Biofeedback enhances the self-awareness and regulation of the nervous system. When you use biofeedback, your clients are able to see their heart rate moment by moment as it changes, their muscle tension, also breathing, and they're able to see this the signals for these things change moment by moment. So if a client is able to see as soon as they make a change in their body or in their thoughts or in their breathing, the signals on the screen or the monitor or whatever they're looking at, the instrument that they're looking at, is showing the results of that change immediately. And that's allowing for faster learning than if you're just trying to explain that, for instance, changing breathing affects their heart rate, or if they relax their muscles, it makes a difference. They can actually see the changes happen. It helps a person to build control over their body and their emotions, and it connects the unconscious responses with conscious regulation. It can also add to traditional forms of talk therapy. So, people are used to in mental health going to a provider, talking about their problems, and of course, working on solutions and so on. But in terms of what's going on in their body or the reactions that happen in their body based on what they're thinking or their anxiety and so on, they're not really able to address that directly. With biofeedback, you're able to see through the objective physiological data the changes that are happening. It also helps a person to not have to rely on self-report of how they feel. They can actually see changes in their nervous system. It engages clients beyond verbal methods. So a lot of times a client might come in and just talk or just listen to you talk. Here they actually are engaged physically and emotionally in the changes that are happening. And they are, through learning relaxation techniques and other techniques, they're learning how to actually have an effect on their nervous system. And that encourages the client to participate more. And you can see there in the image, it's showing some of the sensors that might be used attached to the person. The information is fed into the instrument and then fed back to the person on usually a computer screen. It could be a tablet screen or a smartphone screen as well. And that's where the person gets the information as to what's happening in their nervous system. It can improve outcomes and expand a professional practice. It reduces stress and anxiety and physical symptoms. It's also useful on with diverse populations. You can use it with children, adults, athletes, veterans, and it also adds a unique holistic tool to the practice. And it can get you away from having to only talk to the client and have the client talk to you. Their body actually is speaking to them through the biofeedback devices, and they're able to learn much faster and utilize the biofeedback in a way to help in their improvement of their symptoms. So if this is something that you're interested in learning more about, you can contact me through my email, harry@biofeedbackinternational.com. You can also visit our website, biofeedbackinternational.com. And the phone numbers are there, toll free 877-669-6463 or 914-762-4646 for more information. We do training in biofeedback and also neurofeedback. Our training programs are accredited by the BCIA towards certification. So if it's something you're interested in, please contact us. Thank you.